Hi everyone, Dr. Nemechek here. I want to touch on something that frequently comes up, and parents who I've been working with, they'll suddenly come in and, oh, we had the stool tested by the primary care doctor, and don't waste your money on this, okay? Um, Now, traditional stool testing, which I agree with, when you have somebody with, say, chronic diarrhea of sorts, you might want to, as a doctor, you might want to make sure they didn't pick up a parasite in camping or spring water like Giardia. If you're overseas, there's more common things. And so a traditional stool test for like parasites, and in rare cases you might pick up something like a Salmonella, that's appropriate. But that's when you have chronic diarrhea, okay? Now, in terms of autism, developmental delay, trying to understand what's going on, the problem is when you take a sample of stool from the rectum and they look at all these balanced bacteria, it does not correlate at all with what's going on up in the small intestine where leaky gut is, or not, if you are treating it right. But they'll go through all these machinations about, oh, with this and this family, and they got these charts, and they got these bars, and these are bad ones, and these are good ones, and if you got bad ones, here's something we're going to sell you to take to get rid of the bad ones and help the good ones. It's all nonsense. Nonsense. Okay? And there, you can't tell if you have SIBO by looking at the stool. You can't tell if from these bacterial blends by looking at the stool if you have inflammation. Okay, they're saying you can, but trust me, from a medical scientific standpoint, you can't. They've been trying this to understand this for now 10, 15 years, like looking at the stool balance from diabetics or people who've had a heart attack or people who have cancer and trying to like read these tea leaves, and it's really getting nowhere. And that's because most of the problem with the gut is not in the colon, the bacteria. It's having too much bacteria in the small intestine, causing leaky gut, or as we now call it, increased intestinal permeability and inflammation. Okay? Don't waste your money on those tests. Okay? If they're doing it and somebody else is paying for it, don't even get it. Why even bother? Okay? It's just going to be bad information. That's all. Don't get too enamored with all that stuff. Really, the hard part about this is really it's kind of simple. Fish oil, olive oil, get that gut balanced in the small intestine, and then occasionally you need VNS. And try to protect your kids through the ups and downs of all of that. All right, everybody. Have a good day. Bye.